Assalamu alaikum. This is a case where we are dealing with an interim restoration. The student is going to follow up the patient for caries and other issues, but we're concentrating on the occlusion using partial dentures. Okay, doctor, you said you're going to do upper and lower.
Yes.
Upper and lower partial dentures. This is the bite naturally. Okay, we're going to replace. We are in the jaw registration and we're deciding on the occlusal height, the occlusal position, and the wax registration. Okay. First of all, you said, doctor, that you placed the upper and lower. We were discussing the case just before the filming. I'm going to repeat what you said. You said you're going to place these two here. Okay. Okay. Still, the waxes are not yet adjusted, but the idea is that while the wax is there, we have increased the vertical dimension. So we have two questions. Okay. First of all, do we increase the vertical dimension or not? Do we change it or not? Okay. This is the first question. Second question, do I begin with the upper or the lower? Which one do I begin? Which wax trim when I'm registering this occlusion plane? Which one do I begin with? There is another issue about the occlusal plane. Is the occlusal plane interrupted? Have there been any teeth that have overlapped as well? So all of these combination of stuff we're going to deal with. But first of all, let us say, are we going to increase the vertical dimension or not? Doctor. Can we increase the vertical dimension for a patient? We can. So, first of all, we can increase the vertical dimension because what he has are only anterior teeth. We don't have an occlusal stop. So we are allowed to increase the vertical dimension because we're going to begin to rely on the posterior teeth. Okay? How much can I increase the vertical dimension? First of all, I don't know the original vertical dimension. So what am I going to do? I'm going to ask you, doctor, put a dot here, and measure the resting position, the occlusal, the natural occlusal position, and see the difference between them and the rest position and see how much vertical dimension I could increase. So I'm going to redesign the occlusal plane. Then, after that, I'm going to remove the lower. When we do wax registrations and they are opposite to each other, we do the upper first. What are we going to do as a reference? We're going to do the upper in place, okay, using a fox plane. I'm going to place a fox plane. Okay, so I'm going to accept the position of these teeth, the remaining teeth. This is the lateral, this is the canine. They are slightly tilted. I'm going to, I could reshape this tooth, okay? After reshaping, because it's enamel reshaping, I could slightly reshape this tooth and then or exclude it from the fox plane. How do I exclude it from the fox plane? I place the fox plane all over, but I tilt it in a way it doesn't touch this plane. Leave this slightly over erupted. Okay, so I have two options: either reshaping of this tooth, or excluding it from the occlusal plane. So I'm going to use the fox plane to determine the vertical dimension posterior in the molar area. Once I finalize this, I adjust the lower until I reach the vertical dimension I've decided to produce. So this is how I decide the vertical dimension for this case. Now, you're going to, in the interim phase, you're going to treat the caries, do all of the procedures, root caries, all of these should be resolved. Because this is the function of interim, is to use these as temporary temporary prosthesis. Because in between, we are going to treat all of these teeth, stabilize them. We might do some periodontal work on them. And after we stabilize everything, the patient during that time became adapted to the new vertical dimension. Okay? So we are redirecting the occlusion posteriorly. We are establishing a new vertical dimension. We are treating all of the teeth meanwhile until we finalize our work and see which teeth are we going to keep, which one we're going to change. Okay? Thank you very much.